show your support.
And new developments from Indiana Governor Eric Holcomb to tell you about this evening. This on efforts to reopen our state's economy. He says he is working with neighboring governors to consider an overall plan. Right now, state leaders say data is driving that so important decision.
Yeah, that means the number of cases, the number of deaths, and testing capacity will all be considered before any rollout begins. Right now, the state is communicating with companies on how to safely conduct business. The governor says at this point, every option is on the table.
We're on the right path, and we're making progress every day. But I've said from day one that while we may be one of the first to go into this, my goal is to get us to be one of the first out of it and to have a healthy workforce ready to go.
Now, another important factor is the ability to do contact tracing and being able to warn people who are exposed to a sick person. At today's briefing, the state health commissioner did not rule out a statewide mask requirement. On the federal level, President Trump says his administration is planning to put out new social distancing measures tomorrow. Let's update today's numbers. The number of positive cases in our state now near 9,000. 437 Hoosiers have now died of the virus since the outbreak began. And as the debate continues about when to reopen our nation and our state's economy, the coronavirus outbreak models are giving some varying answers.
Yeah, Fox 59's Russ McQuaid actually shows us why some researchers believe Indiana has not yet hit its peak.
45% of Indiana's ICU beds and 74% of its ventilators are still available for the most seriously ill Hoosier COVID-19 patients. And that means when the surge hits, the state's hospitals are well positioned to handle it.
We're interested in looking at where people are and where we think kind of the next wave will be.
A study by the Fairbanks School of Public Health looks at the county-by-county data to predict when the surge will hit Indiana.
We believe that Indianapolis and the other parts of the state will hit their peak over the next few weeks into early May. Our level of hospitalizations in the center part of the state have been flat. In other parts of the state, they're still climbing up.
A model by the Institute for Health Metrics and Evaluation based on general overall state numbers once predicted the Indiana peak would hit last week. And then earlier this week, it still expects more than 800 Hoosiers to die from the coronavirus, which is about what the Fairbanks model is also forecasting.
All of the models that I'm referring to are right in that ballpark of around 800 or 900. Again, with the caveat, as you said, those numbers have fluctuated. It looks like they might be stabilizing, but we'll have to look and see what tomorrow holds. The general trend has been towards stabilizing down under 1,000.
And the analysts say Indiana may have undercounted earlier deaths that weren't identified as positive cases, and that could add to the mortality total.
We continue to backfill in the mortality statistics and continue to learn more about what the case presentation looks like so that an astute clinician may look at this and say that looked like it was a COVID-19 case.
As to when he thinks that, based on the numbers, Indiana's stay-at-home order may be lifted, Dr. Granis said he expects to treat his wife to a Mother's Day dinner at home on May 10th. Russ McQuaid, Fox 59 News.
Well, a Wednesday that felt more like the middle of March than the middle of April, and temperatures today only topping out in the lower 40s. Some of you have been in the 30s for much of the afternoon. That is awfully hard to do when you've got April sunshine out. That's the view from the camera in Greenwood from Crew Car Wash. You can see the skies have brightened up. The radar has quieted down, but not before we had a couple of bursts of rain and snow and gusty northwest winds. Peak wind gusts have exceeded over 40 miles per hour. Those winds will subside and the skies are clearing out, and these temperatures that are already cold will continue to drop. It's 41 and a wind chill at 32. Feels more like February. Well, the temperatures are on their way back into the 20s overnight. A hard freeze is likely, but skies are clearing out. These temperatures will be well below normal. In fact, our average low is around 43. We're predicting a low of 26 officially. That's hard freeze territory, and we'll track another chance at some snow before this chill eases. From snow chances to highs in the 60s and even near 70 in my forecast.
All right, Brian, thanks. Preparing to say goodbye to a Hoosier hero, IMPD officer Bree Leith will be laid to rest tomorrow. That service will be closed to the public, but you can still pay your respects virtually. Officer Leith's body will be escorted from Crown Hill to IMS starting around 7 tomorrow morning. Her funeral service will start at 11. Then around 12:30, the procession will leave IMS for Crown Hill. It'll pass IMPD headquarters, the Marion County Sheriff's Department headquarters, and the East District headquarters. Anyone out viewing the procession is asked to follow social distancing guidelines to properly pay their respects.
And every day we suit up. We will suit up knowing that Bree is in our hearts and on our minds. And again, we will continue to wear our uniforms with pride and knowing that we're representing her and that her legacy will continue through each of us.
Now, we'll be airing the service and the procession live on Fox 59 and on our digital platforms. If you want to donate to Leith's family, the Central Indiana Police Foundation has created a trust for Officer Leith's young son, or you can buy shirts and hoodies through IMPD. Those proceeds all going to the Leith family.
Also tonight, for the very first time, we are hearing from a Greenwood family torn apart by violence. Police believe Cecilia Babcock, this woman, was murdered inside her home Monday by her fiance's brother. The suspect, Randy Sutt, then got into a shootout with police. Here's his picture. He then surrendered and was taken into custody. The suspect and the police both escaped without being hurt, thankfully. Sutt's brother, Andy, was inside the home at the time and called 911 after the initial shooting. He still does not understand what ignited that kind of violence.
My brother's a murderer. He deserves to be where he's at. Brother or not, he's a murderer.
Hearts going out to that family. Difficult situation. Now, before the suspect surrendered to police, Andy overheard his brother tell officers that people in the home had COVID-19. Andy says that's not true, and the precautions that had to be taken slowed down the emergency response.
Returning now to our coronavirus coverage, new tonight, some county health departments are clashing with state officials over an order signed by the state health commissioner. Yesterday, Dr. Christina Box authorized long-term care facilities to relocate patients both within a facility or between other facilities to separate those who are COVID positive from those who are COVID negative. Fox 59's Kelly Rinke shows us why some counties believe this isn't all that helpful.
All seems normal from outside these doors. However, inside Bethany Point and Anderson, it's a different story.
Madison County, we're a hotspot for long-term care facility infections.
At least 22 residents have died from COVID-19 at Bethany Point, according to the county's health department.
We've got at least 2 facilities that probably 100% infected with COVID, or almost that amount.
Health officer Stephen Wright claims Bethany Point is one of them. He explains the facility planned to transfer 29 patients to Henry County about 10 days ago.
But they had not been tested. So our concern was, why are you transferring them without knowing their exact status?
Wright tells us the State Department of Health eventually tested those residents, and 20 out of the 29 people tested positive, so the transfer never happened. It's why the county health department has been recommending a policy that discourages the movement of residents to other facilities. Then came the state health commissioner's announcement.
Pandemic, we are using every tool available to try to limit the residents in these facilities that are known to be sick or get sick.
Yesterday, Dr. Box signed an order authorizing the relocation of residents in accordance with plans and guidance of the state health department. That could include transfers within a facility or between facilities.
So far, we're doing pretty good because we're starting to see the leveling off of the new patients showing positive and deaths. So we thought we were doing pretty good, so why change it?
This decision also states that any local order contrary to this one is now void, like Delaware County, which said no person from outside the county can be transferred to one of their facilities. As a response to Dr. Box's order, the county health department's administrator sent this letter to local care facilities, calling it a terrible idea, writing in part, The claim that individuals would be tested prior to transfer has merit, but it is flawed. If I show up to your facility and show you a test result from yesterday saying I was negative, would you allow me in? This nursing home on the east side of Indianapolis already established a COVID-19 unit. More than 25 residents here who tested positive were admitted from local hospitals or other nursing homes.
We'll take COVID patients from anywhere. We don't really discriminate against where they came from.
The company who oversees this facility claims this helps save resources like PPE since the positive patients will be together. Madison County is not sure what more they can do.
The idea of transferring people out to either a clean facility or another infected facility, the strain it would put on families as well as the patients who are already chronically ill, right?
In Indianapolis, I'm Kelly Rinke, Fox 59 News.
Dr. Box says all patients will be tested before being transferred regardless of their symptoms. They'll then be quarantined at the new location for 14 days, so if they're asymptomatic, they won't infect another facility.